Oral cancer is a serious disease, and the stakes are becoming much higher than they have ever been before. It's a human right globally to have knowledgeable healthcare providers. In Vietnam, where I did my research study, 56.2% of my patients were diagnosed at the very advanced stages of 3 and 4 in oral cancer. The morbidity was 55% and still is. The normal functions of smiling, eating, and kissing were not so pleasurable anymore. We talk about, let's have an early diagnosis, and we talk about it all the time. Let's do something about it. I remember walking up the worn stairs up to the oncology hospital landing, and this is where the people feed their loved ones. And this one lady, she raises her hands and holds my hand in hers and says in English, "Thank you so much for coming." Well, I had tears welling up in my eyes because I realized I'm just a dental hygienist. What can I do? I'm not an oncologist. And then I realized this. I was bringing her hope. Hope for a world without oral cancer. I can bring education. My solution is this, is to develop a standard of practice model with a University of British Columbia dental hygiene degree program in a collaboration of international information exchange with the National Hospital in Ho Chi Minh City. What we would do is provide oral cancer screening education and cultural oral risk habit awareness. The innovation would be threefold. To have a biannual UBC, University of British Columbia dental hygiene program rotation to bring healthcare providers information about oral cancer awareness. There would be a rotation and a practicum to examine, diagnose, and to treat cases at the National Hospital. And there we would have that international health exchange. I'm basing this on evidence. The studies that have been performed 5, 10, and 15 years ago, there's been no change in the morbidity of oral cancer. In fact, my master's research thesis won the World Dental Hygiene Award in Research that I did in 2010. In that study, I found that there was prescriptions that were given to these people for vitamins and antibiotics, unfortunately of no use. Further research is needed to increase the core of the Vietnamese oral cancer educational capacity to strengthen it through international global health exchange. Well, this impact of this solution would be a long-term research. We'd have 1, 3, and 5-year evaluation of oral cancer diagnosis and the stages. We'd be looking at earlier diagnosis, hopefully, and a decrease in those numbers, and therefore decreased morbidity. We'd also be increasing the economy of the country as the working age population is increased. The management of this innovation would be University of British Columbia alumni and led by myself with a dental hygiene focus. Normally, hygienists focus on preventing cavities and periodontal disease. However, we can also prevent oral cancer disease through education. I would be seeking grants for finances, research, equipment, travel, and on-ground expenses. The stage of this idea is that there is a partnership in place with the University of British Columbia and the National Hospital, as we have a research and educational facility there called the Vietnam UBC Oral Health Research Center. It's on the 4th floor, and it's completely funded by UBC alumni in 2010. However, there is no ongoing direction. In fact, the facility is left empty most of the time. It's not being used. My ask is this, is that funding is needed for increased scale of the use of this new facility by dental hygienists who can take this task with force. I need human resources from other dental hygiene programs and as well feedback from the advisors of this conference. I want to make dental hygiene imprint globally for oral cancer prevention and share this research globally. Thank you.